So everyone, welcome. Thank you for coming to our webinar. This is the Life of a Podiatric Medical Physician and Student. Tonight we have two really great speakers with us. I'm going to go ahead and let you guys introduce yourselves. Dr. Perez.
Hi, everybody. I'm Dr. Perez. I was the class of 2011 from NYCPM. I currently just opened up my own practice about a year, so I'm still part-time at my current job, which is at Crystal Run, but I officially have resigned, and May 8th will be my last day, so I'll be full-time at my private practice in Midtown Manhattan. I did a fellowship in trauma and reconstruction sports medicine at the University of Louisville, Kentucky, and I did go to pediatric medicine at New York College of Pediatric Medicine.
So my name is Will Stallings. I'm a fourth-year medical student, and I'll be graduating officially in 5 weeks. I just went through the match process, and I matched to Yale University in Connecticut. I also went to medical school at NYCPM. I'm the class of this year, 2023, and I also went to undergrad at Manhattan College back in 2019.
Yeah,
go Jaspers. Yeah.
Awesome. So the way this is going to work is I'm going to ask you guys a couple questions. Some are directly at both of you guys or directly at one of you individually. To all of our attendees, if you do have any questions, you can go ahead and put them in the Q&A and I will pose them to our speakers. And then I'll also just have some time at the end to just go through all of the questions that we have. So I want to start with the most basic thing, right? We can start with Dr. Perez and then go to Will, but tell us about how you came to podiatric medicine. How did you first become interested?
So I was an athlete. I played tennis. I actually got a full ride to Manhattan College as a Division I tennis player, and I had bunions that were very, very, very painful. Throughout my time there, I always had foot pain, and then eventually after I graduated, I went to get them checked out, and then that's how I was introduced into the world of podiatry, because I was a patient first. I actually had bilateral bunion surgery, and that's how I got introduced. And since then, I researched it as something that I liked, and I always wanted to be in medicine. Surgery was a big aspect for me, so I enrolled at NYCPM. That's how.
Well,
Nice. I have a oddly very similar story, but I didn't get surgery on my feet. I've been an athlete my whole life. I wanted to do sports medicine, trauma, and I also ran track at Manhattan College. I had tons of injuries. I had plantar fasciitis. I have hallux limitus. I had 2 hip surgeries, and I knew I wanted to do sports medicine surgery. So when going through the process, I was like, okay, maybe I'll go PA. But then I said, one more year of education, then I'll be a doctor. So let me look at what medical school has to offer. And I only thought, MD, DO were the only 2 options. And I wasn't super excited about it because I was like, I don't really want to have my future be up to board scores. So I looked further and found podiatry, where it's a guaranteed surgical residency, where I knew I would be able to work with the population that I wanted to work with and do what I wanted to do. So I applied to NYCPM, got admitted, and started my journey.
all right. So building off of that, Will, can you tell us a little bit about your studies at NYCPM and how the first, second, third, and fourth years, how they all differ?
So many of the people on this call probably know a little bit about what the curriculum is like at medical school. To quickly answer, it's pretty similar to medical school, right? So it's 4 years of a medical degree. The first 2 years are going to be your didactics. Your first year is going to be all your medical courses that set you up: anatomy, biochem, physiology, pathology. And then your second year is more of those didactic courses, but you start to specialize in podiatric medicine. So you start taking courses like podiatric medicine, podiatric surgery. And then your third year is rotation based plus academics. And it's pretty strictly podiatric medicine and some systemic medicine, but you start to focus in your third year. Fourth year, you focus even more. And then you do 3 years residency, and then you're a surgical podiatrist. And that's one of the reasons why we have these shortest residencies, is because we start specializing at year 3 as opposed to year 4 or in residency.
Quick question. What would you say is the hardest part about your studies at NYCPM?
Ooh, the list is so long now. I'm joking. No. I would say the hardest part is, taking a step back and looking at the big picture. Because a lot of times you get bogged down by some little details, right? Like, oh, I didn't prepare enough for this exam, or, I'm missing this social hour, because a lot of my friends didn't go to medical school, so they're gone, partying on Saturday night. I have a test Monday morning, and like in that moment, it's like, it's really hard. But like taking a step back and look at the big picture, like that was a hard thing, but once you start to do that, it becomes significantly easier.
Okay. Dr. Perez, what was the hardest part of pediatric medical school for you?
If I can remember. No, it's been a while actually. I was married at the time, so I became quite the nerd during school, 4 years of just studying. It was hard to do all of it, but it was very, I was pretty successful, and the rewards are amazing. I graduated 4 years later. I did my residency. I did a fellowship, which you don't have to do, but I wanted to stay in New York, and in order to stay competitive with the orthopedic foot and ankles, you should get a fellowship, especially if you want to practice in New York. So that's why I did that extra year. But during school, I remember just the lab, the classes, time consuming, but it's something that you want to do, right? You decided to do this. So study, get good grades, be at the top of your class, because it's a lot of money and you don't want to waste 4 years of not being serious about your studies. You are going to be a doctor and you will be responsible for other people, especially in the lower extremity. I was an athlete. Will, you're an athlete. I like to think I'm still an athlete, but my goal was to get people better, and I'm doing that now. So it's very rewarding.
Okay. Well, I know you just recently went through the match process. Congratulations on that pairing, by the way. Can you tell us a little bit about how, your externship works and how the match process worked in general?
So basically, your first 2 years, like I said, was your didactic course. Your third year, you're in the clinic and you're learning all the skills that you need to become like a first-year resident. And during your fourth year, you basically do 1 month long learning externships, and there are mini interviews for you and for the program of you. So the program will often bring you on 1 month at a time and treat you like a acting intern. Some places call you AIs, acting interns, and you have the role of an intern. You're rounding on patients, you're helping in the OR, you're helping in clinic, you are managing patients to the level that you prove yourself. Right. So that's really exciting. And that was the first time in my medical education where I felt like, wow, like I'm really being treated like a resident doctor. And it was exciting. And it was great to see the culmination of all my studies and the clinical training that I got at NYCPM come together and really, work in different environments. So for me, that was one of the most exciting periods. I externed at 5 places. I externed at the main Yale campus, the sister Yale campus, Georgetown MedStar, Hoboken, and Long Island Jewish. And they were all very unique experiences. I saw different types of patient populations. I saw different type of attendings work, and I learned so much because different regions, different hospitals do things differently, and it just really lets you hone your skills and pick things that you like, right? There's different ways to slice bread, right? So you learn these different techniques, you see which one works for you, which one has better outcomes, and that was really cool. But it's also like a daunting thing, right? Because on the other end, you're evaluating the program to see if it's a good fit for you, and the program's evaluating you to see if you're a good fit for them. So you have to be like, on your game. I was studying before cases. For example, if we had an ankle fusion or an ankle fracture the night before, I was reading up on it so that I was ready in the OR if they asked me a question, or if they asked me, okay, what's the next step or whatever, so I could show that, hey, I'm prepared, I want to be here. So that was exciting. And then the match day process is one of the most nerve-wracking and exciting periods of your life, right? Because you could essentially end up anywhere that you rank. Some people, they rank 15 places. Some people rank 3 and they want to scramble because they're like, what? Like, if I don't get my top 3, I'd rather just see what's available. But your whole life is kind of balanced on this one decision in one day. But it was exciting, and I matched my number 1, and it's a very good program. I'm really excited, and I am so grateful that I chose NYCPM. I've made so many connections, and I'm exactly where I want to be in life, right? At a great residency program, surrounded by great people, made great connections. So the process was stressful, but amazing at the same time.
So building off of that, why did you choose Yale's program?
So why did I choose Yale program? Is there anybody on the call from Yale now? That's like an interview question, right? Like, why us? The reason being is because I felt as though it was one of the most well-balanced programs that I went to, right? There's some programs that are surgery, 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 right? Where you are a carpenter, you go in and you're doing trauma all the time, you're doing amputations all the time, and they're not as much clinical based, where they're not teaching you as much billing and coding, managing patients, when to do surgery, when not do surgery, which I wanted a little bit more of that because I could see myself potentially working in a private practice setting like Dr. Perez. Congratulations to her, she's killing it. Or working with orthopedics, where you have to learn how to manage patients clinically, not only like what to do, how to diagnose it, but when to do surgery, what to do when things go wrong, how to bill it correctly. Like, and I wanted that too. And then also, same thing with choosing college, right? Or choosing a medical school, the alumni connection, right? The prestige of the program that you're going to matters, right? And when you go to apply for jobs, et cetera, they see, programs like, New York College of Podiatric Medicine, or they see programs like Yale University, like, okay, they know the caliber of education that you're getting. And I felt that going there, and I knew they had a strong alumni connection. And I like the area, right? The little things, like I felt happy there, right? Like, I mean, people on the call might not get it, but when you're in the OR and you're scrambling to find a thyroid shield, right? Or it's like beat up or something like that. That's like another stress you have to think about, or the supplies aren't where they're supposed to be. But like the hospital at Yale, like it was just smooth. OR turnover was like this. You didn't have to worry about the little things, which I thought was nice. They gave me free lead. The pay was good. Like the things that would just make your life not miserable when you're already working hard. So yeah.
So do you feel confident in your choice and in your abilities, like going into residency?
Oh, 100%. I feel extremely well prepared coming out of NYCPM. Like anything you do in life, it's what you make of it, right? The resources are there for you. You just have to go get it. And that's what NYCPM is. If you want to be an amazing physician, you will be that. And I know Dr. Perez could speak more on that because she went to the school as a student and she went here as a resident and is in one of the best positions that, a podiatric surgeon wants to be in. So I don't regret my ever choice at all. I'm very happy I did. I'm excited about where I landed. Yeah.
Awesome. So while we're on the topic of residency, Dr. Perez, can you speak about your experience in residency and then in fellowship as well?
Yeah, so my fourth year, like Bill mentioned, you do go on externships, and I traveled all over the country actually because podiatry, it does scope of practice changes throughout the country. So I knew I wanted to do more reconstruction and ankle work. So I did go out west. Not that that's not done in New York. And actually I'm part of the board, the New York State Board of Podiatric Medicine, in order to change the scope of practice, which we're working on right now. And it looks like it might be successful within the next year or maybe two. Yeah, it's very exciting, and we're going to add total ankle replacements because that is what we do now instead of fusions, although fusion is still number one choice. But anyway, so
wait, can you say that again? That went through?
It hasn't gone through yet. We're in the process of changing the language, but one of the main people that were opposing, not just podiatry in general in the state, this person has now left that position. So there is a new person in that position. So it's more positive. Like we're hoping that will change. So we're working on the language right now. So good things to come for the state of New York. Yeah. But anyway, so I went to Seattle, San Diego, Denver, Boston, and just how things work out. I ended up at the school, and I'm very content that I did because I got excellent training from just forefoot, the foot and the ankle itself. The hospitals I was part of was Metropolitan and Lincoln Hospital, and you don't get much more trauma at Lincoln Hospital. I mean, that's in the Bronx. You just see trauma. And I was very lucky to have very good attendings, ortho and podiatry, that trained me very well. And like I mentioned, I did decide to do a fellowship mainly because I will be competing with foot and ankle orthos, and I wanted that fellowship experience. And I went to Kentucky, and all it was trauma and reconstruction at the University of Kentucky. But yes, so for 3 years of residency, 1 year of fellowship, and it was great. It was absolutely great.
Awesome, that's good to hear. Obviously, so I know after residency, you eventually started working in a healthcare network. I'm not sure if that's what you did immediately, but can you speak a little bit about those experiences?
So I'm still here. I'm actually here. Crystal Run Healthcare, it's up in Newburgh, my office. But like I mentioned, I officially resigned. So I've been here for almost 9 years, and it was my first job out of fellowship. And I mainly did get hired to be the foot and ankle surgeon in this location. So I was able to get all my cases. I was able to get certified right away, and I got the advanced ankle license within a couple of years of me starting. So I started in 2015, and by 2018, I had the advanced ankle license, which it's a lot for New York. There's only 30 podiatrists in the state of New York that have this license. And that's another thing we're trying to work as the board that everybody should be able to do, especially if you're trained. You shouldn't need a special license to do ankle surgery, but that's another topic. So this is a multi-specialty group. When I started, there was about 400 physicians. Now there's about 650, maybe 700. It's a large institution. And the good thing about this type of job is that there's all the different specialties within one location, right? So you can just refer back and forth. You have the records of all the patients, what they're doing. If they're diabetic, you can see their labs, and everybody just stays in. So it's very productive in that sense, and it works for the patients because all their doctors are within one system. But again, I got hired as the foot and ankle surgeon, and I've been here for almost 9 years. But you know, I live in Manhattan, and this is about an hour and 10-minute commute. So I decided enough, and that's when I decided to open up my own private practice. So now I'm in Midtown Manhattan, and I will be full-time there May 8th. And I'm starting to see patients there. Obviously, I'm operating. I just got credentialed at Metropolitan, actually, so and Mount Sinai as well. So I'll be there.
Yeah. Congratulations on your new practice, by the way. That's awesome.
Thank you. Thank you.
Can you elaborate a little bit more on how that experience, or how you expect that experience to be different than working in a healthcare network?
Well, so now I'm it, right? There's now I have to make more connections, which is something that we'll hit on. You know, the connections that you make at your residency program as well as the school, invaluable, because they are. If I need a vascular surgeon, I can just pick up the phone, you know, call Dr. Trupples, like, who's good vascular, and he'll refer me to somebody, and everybody that I've met, even from all the hospitals. So that is a good source. But that is the difference. Now I have to find somebody. Like if I need to send a patient to vascular, I need to send a patient to internal medicine, whatever, that's on me. It's not just so easy as, oh, let me see who's working or who's on call, right? Because I'm not part of a huge system. So that does change. However, the other side of that is I am my own boss now, right? So nobody gets to tell me I have to do this, I have to do that. You have to see this many patients, you're on call, you have to work. No, that's all said and done. At Crystal Run, I was seeing 40 to 45 patients a day. I am not doing that. Like, you know, and it was great. It was great, but I'm not doing that anymore. So private practice, insurance is eventually you'll learn. You could be in network, out of network. Currently, I'm strictly out of network, and it's going well so far. So I'm doing well.
Okay, awesome. So I want to shift gears a little bit back to your time at NYCPM. Where did you guys live during your studies at NYCPM?
I actually lived on the Upper West Side, 79th Street. So I had my apartment there. It was easy commute, took the train, the 19, and then just walked a couple of blocks over to the school.
Well,
so for me, I was extremely apprehensive about like how successful I'd be in medical school, right? Because I had a little bit of imposter syndrome. So I wanted to make sure that I was very close to school. So my first 2 years, I lived on 122nd West between Frederick Douglass and Adam Clayton Powell. And that was about a 10-minute walk, 3-minute jog away from school. I didn't want to have any reason to be late, miss class, have anything to deal with. So I did that for my first 2 years. COVID hit, and the rent prices went up in New York City. There was a lot of different things going on in the city. So I decided to come back to my hometown, which is now 30 minutes, ideally on a good day. And if it's really bad, it could be an hour and a half if there's traffic accidents. So I've been commuting since third year, and still commute now, and it's not bad. But yeah, and the cost of living is feasible if you're smart. Roommates. Location is key. Dr. Perez, she lived in a very nice area of the city. I lived in a less nice area in the city and had 2 roommates, and I managed my rent. I think I was paying like $700 a month. So, you know, I wanted to save money, not have any reason to be late for class or miss anything or stress about it. And it worked for me.
Yeah, I know we have students who live kind of all over the place. New Jersey, the Bronx, Staten Island, Long Island, New Jersey. We already said that. You get my point. Brooklyn, that's the one. Really all over the place. So you can really find something that works for you price-wise. And we also do have the lowest tuition out of all of the podiatric medical schools, and that's very intentional because we understand that the cost of living in New York City is as high as it is. So we do try to keep that as low as possible. Another question for you specifically, Will, what is your opinion about having a job while you're in medical school?
Personally, you asked my opinion. Horrible idea. I think your primary focus should be school. This is an investment for your career, for your future. The max $10,000 to $20,000 you'll make is going to be a drop in the bucket compared to what you're going to make, especially if you find yourself as a highly competitive applicant. So that's the way I saw it. I took out loans. I took out a lot of loans. I just took out more loans, and I'm okay with that because the mentality is, the work that I'm putting in now is going to pay off later. I do know some people that worked and they struggled. They worked on the weekends and they worked nights, and they passed classes. They did what they needed to do, but their academic standpoint went down. And they knew it, and they were okay with that because they wanted money. They didn't want to take out loans. Like, different people have different things they have to worry about. There's families, there's, some people already maxed out loans and needed more. So I don't want to say like you shouldn't do it and like it's a terrible idea for everybody, but some people have to. But I highly, highly recommend against it. There's no problem with taking out loans. I don't even know the average cost of like how much loans a medical student has, but it's up there. So it's okay. You don't have to work right now. Focus on school.
Dr. Perez, I saw you agree?
I actually did have a job because I used to work at Mount Sinai in the pathology department before I decided to come into podiatry. And I kept my job, and I did it for not even 3 months. I remember I got a low grade in an exam, and I was like, no, I can't do this. This no way. So I quit, and I focused 100% on school. And again, this is an investment. This is not cheap. This is a lot of money that you are going to spend on you. So, study, focus all your time and effort on this.
Okay. So, question for both of you. How do you think that NYCPM stands out?
For me, I'm a New Yorker. I've always lived in New York. I wasn't going anywhere else. That doesn't take away from the school, but I was definitely staying in New York. Aside from that, it is the oldest school, and it has one of the best, if not the best reputation with the people there. They have a clinic within the school. They have a residency program. It's very academic. I'm a very academic person. Journal clubs as a resident, but during school, it's the oldest school, and it's great. I mean, everything I've learned, and when I went out on externships, I knew what I was talking about, and I can compare myself to other students, and perhaps they had never heard it. And maybe if you forget something, but you remember that, oh, Jules said this, or Treppel said that, or Rice said something. So the education that you get there is uncomparable, but also a lot of it has to do with you, right? You have to do the work. You have to study. I remember, I think they still have it, right? The video capture. So if you go to lecture and you want to listen to it again, I mean, I was in the library with these things on after, because you miss little things, and listening to it once live and then going back before an exam, I would re-listen to every lecture before exams, and it stuck. And that's one of the great things. And then we also had people who wrote the notes, right? The dictators, they wrote the class notes and they were handed out to everybody. Yeah, I mean, this is also 12 years ago. So, well, what's it like now?
It's pretty similar to what you just described, which is a good thing. There's a tried and true system of making people very, very prepared and extremely smart, capable physicians, and it's the same system. But to share a quick story, outside of, yes, New York, I'm from New York, I wanted to go to New York, stay here. But when I was out on externships, you're out on externships side by side with students from all other schools, Midwest, the South, Florida, whatever. And I had a pin on my jacket that stands for Pi Delta. And that means that you have a right? And that's a national honor society amongst all the podiatric medical schools. And the assistant director of one of the programs that's highly respected stopped with me and a bunch of others, said that pin means way more coming from NYCPM because I know your GPA is real and I know how hard.
Oh no. Okay, well, I think we got the gist of what he was trying to say. I don't remember what the GPA requirement was, but okay. Well, sorry, we lost you a little bit
3.5.
there.
Did
What
you
was
hear
the
this?
GPA requirement for the Pi Delta?
Oh, I didn't say it out loud. But it's up there. It's a high GPA, but it was really like they know that
You could say it, it's
that GPA is
3.6.
real. Yeah, I think it's 3.65 or 3.67, something random like that. Yeah, but once you get to that and above, it's across all schools. And they know the rigor of our program. They know our program is real. Like they know that our students are matched up to some of the best allopathic students. And that was carried across. So when anybody says why only CPM, that story immediately comes to mind. Like people know, like, oh, this is a very, very rigorous, solid, reputable podiatric medical school.
Very true. So building off of that, the last question I have on my little paper before I open it up to questions from all the attendees, what advice do you have for future PodMed students and physicians?
You want to go first, Dr. Perez?
Yeah.
Sure. From my perspective, with anything, do your research, right? Understand what this profession is about compared to what you think you might want to do. If you are looking into podiatry, shadow podiatrists out there, you're welcome to come see me. My information is there. You can get it from the school, but kind of make sure that you know what you're getting into and that you want to do this. And it's not a second choice because you didn't get into this or you didn't get into that. And study. Like, I mean, I can't, whatever you decide to do, be the best that you can be at whatever you choose to do. For me, podiatry is a great profession. I get to treat patients, do surgery, reconstruct. Actually, I had a patient today I did an ankle fusion and he knows I'm leaving the practice and he hugged me and he said, "You changed my life. Thank you so much." Because he could not walk just due to arthritis. And it touched me. I was like, oh, okay, so great. But you will be changing people's lives. People underestimate their feet until they hurt. And then once they start hurting, you understand like, oh, I can't walk. I can't go to the store. I can't go up down the stairs. I sprained my ankle, my ligament. And podiatry encompasses all of that, right? Not just bone and soft tissue and ligaments. You have the skin, you have vascular, you have the diabetics. There's a little bit for everybody. Whatever you want to focus on, podiatry is there for you. But you have to be the best that you can at whatever you decide to do.
Well,
I think that was a really good answer. So I have to think of something different. Okay, so the advice that I would give anybody before going into whether it's podiatric medical.
oh no.
Connection.
Okay, no more questions for Will.
Well,
No. I'll give him a second when he pops back in.
Am I back? I turned my video off. Did that help?
You are back. Yes.
Okay. So enjoy everything. Enjoy the time that you have before school, right? The summer before school, enjoy it. Spend time with family and friends and enjoy the struggles that you're going through with your classmates. Like remember why you're doing it, and have fun with it. That would be the best advice I have because it could get tough, but make sure you enjoy it.
Awesome. Good advice.
it does get tough.
Yeah, it does. I'm not a student, but I see that it gets tough for sure. Dr. Perez, can you speak about your work-life balance?
Well, now it's a lot better because like I mentioned, I am my own boss. But even at Crystal Run, I worked Monday through Friday. I was on call once for a whole week, once every 4 to 5 weeks, depending. I'm married. I have a son. I have a 4.5-year-old. And life is good. I can't really complain. On call, it gets stressful, right? Because you can get called at 3, 4 o'clock in the morning. But overall, even at Crystal Run, I was pretty happy. I'm a little bit happier now because I get to set my own schedule, like I mentioned. And it's, I'm my own boss, so it's my own call. But this is a great profession for women, especially if you want to have family life and you want to have children. You could do with this profession what you want. You can make it as demanding as you want. You can work all day long. You can take all the call. You can see all the patients, or you can back off a little bit and decide, okay, maybe I don't want to be in a huge multi-specialty group. Maybe I want to go into a private practice where there's 2, or you want to open your own practice where you might not have to do call or see, 40 patients a day. You do what you want to do with this profession, and it's very amiable for that.
Will, what about your work-life balance?
So my work-life balance now also became significantly better. And every year is a little different. So the first year, it was work, a little bit of life. Second year, work, a little bit of life. Third year, it was work, some life, because you're also doing clinic. So like oftentimes, like a bunch of our friends would go out after clinic if we didn't have an exam, partake in alcoholic beverages to a comfortable level together, because we're going through something difficult together, and it built such a strong sense of camaraderie, which I'm gonna have friends now that I have for the rest of my life. So the moments where we did get to like enjoy life were 10 times better, right? And fourth year is amazing. I love it. After I matched too, it's like, you got a job, all your hard work paid off, and now it's just meeting the requirements until graduation. So I just went to the Poconos this past weekend with people. It's a fun, cheap way to like hang out with a bunch of people. We go out all the time. I'm home now at 5. It's great. It's great.
Awesome. Will, could you start by answering this question about preparation for boards? How'd you do it?
Say it again.
How did you prepare for boards?
So I don't know if I'm the right person to ask, because I might scare some people, because I definitely studied really, 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 really hard. So we had about 2.5 months off to study for part 1. And I studied 6 days a week, anywhere from 8 to 12 hours a day. I would literally wake up 8 a.m., brush my teeth, get some breakfast, do whatever I got to do, and then sit in a chair until 6 to 9 o'clock at night and study. Then I would go deal with what I had to deal with at night or hang out with people. And then I would have 1 day off during the weekend that I would give myself. And I did that for about 2 months straight. Very similar to what some people might do for the MCAT, but that's what I did for boards part 1. I know there are other people that studied a little bit less than me and passed, but I wanted to make sure that I passed without question. And there were some people that did not pass that did less than me. So I did a lot, and I do not regret it. There's things I learned studying in that period that I've still have not forgotten. And my program is a program that medically admits. So there are like medication lists that I still need to know, that I'm still like asked about, whether it's beta blockers for hearts or blood thinners prepping for surgery, antipsychotics that you need to know the counterindications for when prescribing, antifungals, like all these things I still remembered, and I'm using them. So I studied hard, but it was worth it.
Dr. Perez, what about you? You are muted still.
So I took boards for school, right, a long time ago, but for certification, to be board qualified and board certified, I studied a lot. But it's when you get to that level though, residency, after residency, there's nothing that you can really sit down and open a book and read, right? It's what the 3 years that you have done. So you've been studying all along just by seeing patients and medically treating them and doing surgeries and all the rotations that you do, general surgery, derm, vascular, so you've been studying. So it's harder. It's not as like a USMLE or, the boards part 1 that is specific topics is patient management. And that's what you've been doing for 3 years. So I went back and I remember reviewing basics, but it was mostly case scenarios. That's how those boards work. And, I did well. I passed them on my first try, both foot and rear foot. I'm certified, as I mentioned. But it's a different type of exam because it's just is testing how you would manage a patient, whether that's medically or surgically.
Can you talk a little bit more about the advanced ankle certification?
So yes, so in New York State, and there's 3 other states in the country, you need to have a special license in order to do certain procedures at the ankles, not all of them. So you graduate residency and you have your podiatry license. Technically, you can't do ankle fractures, you can't do ankle fusions, total ankle replacements, nails like retrocalcaneal nails going into the tibia. So you need a special license for that. So you have to be certified, and then you apply, and then you show case logs of cases that you've done, and then you get the advanced license. So there's a standard right now where you can do basically everything except those procedures I just mentioned that are reserved for the advanced. So me wanting to do a lot of trauma and reconstruction, I need accessibility to those types of procedures. So that's why I sought out to it very quickly, and I was able to get it. But it's changing, right? That's the point where I believe if you're well trained and you're trained now, all our training is 3 years, and you get a rear foot certification, rear foot and ankle, then you should be able to do those procedures. And that's what we're working hard on right now. And that's part of the New York State Podiatric Medical Association, NYSPMA.
Can you talk a little bit more about NYSPMA or any other organization that DPMs should be involved in, or you suggest that they should be involved in?
So the American College of Foot and Ankle Surgeon, ACFAS, you can go to the website. That is a very surgically based program, and they do lots of conferences. There's a main conference every year that we just attended out in LA. Great topics, great time. Then there's also ABPM, which is the American Board of Podiatric Medicine, and they have their yearly conferences, and those are the 2 main ones, I would say. There's the American Board of Foot and Ankle Surgery, ABFAS. So you can become, once you get certified and you take your boards, you are part of that. Obviously, they have yearly payments that you have to make, but that's with anything. But ACFAS, ABFAS, ABPM, and of course, in the state of New York, every state has their own Podiatric Medical Association. So in New York, it's the NYSPMA. I'm involved. I'm part of the board. Well, if you come back to New York, you should definitely, become involved. We encourage all.
I'm coming.
Okay, good. I'm glad to hear that. So if you're a resident, it's free. As an attendant, there is obviously a payment, but there's fees. But the board, the association works hard in order to improve the scope of practice and just overall podiatry in the state of New York. And that's why I joined. Like I mentioned, I'm a New Yorker. I believe this is the best state, so it should also be the best state for podiatry, and we're working hard on that.
Okay. Did either of you take a gap year or something like this in between undergraduate and med school, or did you go straight through? What was your path? Dr. Perez, if you want to start.
Yeah, I definitely have a non-traditional route. So I graduated in Manhattan College in 1999. I started working at Mount Sinai, like I mentioned, the pathology department. I decided to get my master's in physiology at New York Medical College. My mom and I decided to open up a restaurant in Upper West Side between 98th and 9th on Broadway. But we signed the lease September 10th, 2001. So we all know what happened then the following day, right? So we were shut down for almost a year. And then finally we opened, and it was very successful. We had it for about 5 years, but it's a lot of work. So eventually we sold the restaurant. And during all of that is how my feet started hurting. I had the bunion surgery done on both my feet. And then I researched podiatry, and I signed on in 2007 for the class of 2011. And the rest is history.
How did you feel being a non-traditional grad at NYCPM?
Actually, there was a lot of non-traditional grads in my class year, but I was definitely older. So perhaps I took it a little bit more seriously. And I get it, you're right, you're in your 20s, you just graduated college, you're in med school. But my focus was to study. So I did see that discrepancy between the younger or just graduated college to olders. I guess we just maybe take it a little bit more seriously. We're paying out of pocket, loans. It's just, it's a different perspective. I do think, obviously if this is what you want to do, go for it, but it's not a bad idea to go explore, find yourself a little bit and decide that this is really what you want to do. And that, again, that goes for any profession.
Will, what was your experience?
Before I go on my experience, I just want to say that what Dr. Perez does on a diplomatic / policy advancement is huge. And we need more podiatrists and need more physicians like that because, physicians need representation on a government level, and that can't be undersold, at the opportunity that is given to podiatrists to make the field better. So thank you, Dr. Perez. But my course was more traditional. So I went to college for 5 years, which is a little bit untraditional, but the reason why was because, like I said, I ran track and I had a surgery. So I redshirted. For anybody that doesn't know, that means I got injured, but you're able to stay on the roster on scholarship. I also went on full scholarship, and that allowed me to take more courses. So I graduated with way more than I needed, because also you need to be a full-time student to stay on the roster. So I graduated with a pre-health concentration, pre-PT concentration, minor in chemistry, minor in biology. So I did a lot of school, and it prepared me to go straight into medical school, which some people don't have, right? A lot of people do a post-bac or whatever, or take time or study, but that was my post-bac. So I graduated in 5 years and applied and went straight into med school. So I think that was helpful, right? It's like the same concept of doing a post-bac or a gap year, because it allowed me to, take some classes to up my GPA, to explore some more options. And yeah.
And yeah, awesome. Well said. Just kind of building off of that, I know that the average age of our students at NYCPM is about 28 years old. So that speaks to the fact that, there are definitely students who do not go straight from undergrad into med school. I personally am always a huge fan of gap years. I think it just gives you time to figure out more about yourself, right? But that's a personal decision. Anyways, that was the last question. Yeah, you agree?
Yeah.
Do you wish you would have taken a gap year?
Well, my 5th year was like a gap year, because the minimum credits to be a full-time student is 12 credits, which is reality. If you're on campus, it's not that much. So it allowed me time. I was working, I was hanging out, I focused on track. Like I was like, this is going to be my season. So it allowed me to just like have a breather year and like figure it out slowly. So that was my gap year. And I think that was amazing, right? I think having to jump straight in after hard coursework of 4 years of rigorous college would be difficult.
Changing gears a little bit, I know that you are both athletes. Do you still find time to actively, play tennis or run for either one of you? Dr. Perez?
So I don't play tennis as much anymore, and I actually want to start doing it again. Tennis was kind of like my job. So once I graduated, like I've been playing since I was 9, and there was tournaments and this and that and rankings, and my mom pushed me, and I thank her for that, because otherwise, I wouldn't be, from that perspective, where I am. But I was burned out. So once I stopped, I finished college, I hung up my rackets. I said, I'm done with this. But I'm trying to get back to it. I'm a runner. I've done 2 New York City marathons. I'm going to run the marathon this year as well. Tons of pieces in I'm a salsa dancer. So I dance salsa too. I perform with Yamule company in the Bronx. And I do that at least 3 nights a week, if not more. I mean, yeah, so still there.
That is very cool. That's something I've always wanted to learn how to do. Will, I would love to. Will, what about you? Do you find time to be active, play sports?
For sure. But to speak more on work-life balance for Dr. Perez, what time do you dance, Dr. Perez? I think I forgot. Tell the crowd what time.
Why? So the salsa life is a little different. It doesn't really start till like 10 p.m., 11 p.m. One, like if I'm performing around midnight, 1 a.m. So, but I do it and I get up and I work the next day. So, like I said, you can do it. It's just, you have to balance it.
She balances it
Thanks,
very,
Will.
very well. Yeah, when I heard that, I was like, what? When do you have time? But she makes time, and she's a mom and private practice. She's killing it. But for me, yeah, I definitely stay active. I think, and this may not be a popular opinion, I think studying is just as important as exercising and eating well. If you aren't taking care of your body, you aren't sleeping well, you aren't eating, you're not exercising, you're not going to perform well academically. You're just going to be slower off the ball in my head. And there's research to support it. So that was like the motivation for me of like, I got to stay fit because it's going to make me more productive. And yeah, so like, 20 more minutes of studying is not going to do me much good as opposed to doing a 20-minute run, right? Where I could just like get good exercise, sweat, stay healthy. So that's how I looked at it. People are like, oh, there's not enough time. Like, you're really going to learn that much more if you took 30 minutes off to go work out? I doubt it. So
That's a good
yes.
One of the questions that we have is about our dual degree program, the DPM and PH, which I don't believe either of you are MPH students. Okay, I'll speak to it, no worries. That program is at the Icahn School of Medicine at Mount Sinai. It's a really great program. It's something we tend to recommend for students who are interested in the bigger picture. What are trends in healthcare in general, or maybe you want to end up like running your own department in a hospital or something like this. You end up taking your classes at NYCPM for, you start in the morning and you go till the late afternoon, and then you would go to Mount Sinai and you would finish your evening there. It's a lot of classes, that much is for sure. I mean, obviously getting your DPM in general is pretty difficult. So if that's something that you're interested in, I always say email me. I'll definitely pair you with the students in the program. But what I have heard from students who are in this program is that while it is a lot of classes and the material is somewhat similar, you're looking at the material in such a different way that it's not quite as mentally as exhausting as you might expect it to be. So a little bit like a break for your brain in more classes, at least that's what they say. So I know that it's 100% possible, and they definitely enjoy it. They end up completing the program in 4 years or 4.5 years if they start in January, because that program is a little bit different. So I will definitely
I could speak on it a little bit more. So 2 of my best friends did it. One of them did it as a traditional student, and the other one did it as a Janney student. And I would highly recommend doing it as a Janney student because you have so much more time and you get it done even quicker and earlier. And she's amazing. Like, she's going to graduate with MPH. And my other good friend, he's going to graduate with MPH, and we both, talked about where we want to be at in life and career, et cetera. And, maybe being a director of a residency program is something that I would want to do, but I'm at a disadvantage to him, because he has that degree of public health or management or master's in business or public health, which is something like I if I could go back in time, I would definitely consider doing it. I'm considering doing it after I do residency, right? Like taking courses at night or in the evening. So I recommend it if you can balance it. But if you're a Janney student, do it. Why not?
Okay, that's a good point. Also speaking with like the jobs too, if you are going to work during med school, please do it in the January program. And only for your first year and a half, because you do have a lighter course load in that program. And if anyone has questions, please email me and I'll discuss that a little bit more. We do also have a video on that as well. Anyways, that is the last questions that we have. Thank you so much, Dr. Perez and Will. I really appreciate you guys coming. I think that, I learned a lot. I always learn more and more at all of these events, no matter how many people I'm speaking with on a daily basis. So thank you so much. I really appreciate it. And
No problem. Take care, everybody. Good luck. Bye.
Take care.